Hey everyone, it's Dr. Gage Winkles here bringing you a short video today. And I just wanted to go over a great question I had in clinic here today. And the question was, is pain a problem or is it something that we can consider to be normal with training? That was a great question and it sparked an interest of mine where I figured we should talk about it. Now, daily pain or pain every time you train, whether it be weightlifting, running, Pilates, is not normal, okay? This is something that we can expect some minor aches, maybe some muscle soreness. There's a term out there that's classified as DOMS or delayed onset muscle soreness. That is normal when we're working our tissues hard, working out those muscles. We have some muscle breakdown, and then we build on that to build muscle. That is normal, okay? But having what we'd classify as pain every time you do an activity is not normal. Now, we're getting to the part of the year where some fitness routines have maybe fallen off a little bit. Others you're still pursuing strong, but some of these aches and pains after a workout may be starting to linger a little bit, and that's what we want to talk about here today. If you are noticing some mild soreness after a workout or an activity, we can call that normal for the time being. However, if that's lasting more than 48 to 72 hours, that is no longer normal, okay? When we have pain that's lasting longer than that typical time for the delayed onset muscle soreness, that's a sign that we need to have someone take a look at that. Now, here at Health-Fit Chiropractic, we'll go through a thorough examination or a re-examination. We'll address that issue and we'll determine how we can best treat that issue. It may be something we need to work on some mobility. That might look like soft tissue release, such as ART, or joint manipulation. It might be something we actually need to incorporate some stability with, and that may look like more rehab techniques and some of the techniques we utilize out in our rehab area, especially with our tonal gym system. But we need to classify how we can best treat that so it doesn't continue to linger. The worst thing that we see happen with people on a fitness journey or trying to achieve new fitness goals is that delayed onset muscle soreness lasts a couple days and then they hit another workout and they never really recover from that first workout. And then a day or two later, they hit another workout. And now we've started this compounding effect where the body isn't recovering properly and we become a higher risk for overuse injuries like sprains, strains, tendinitis, things like that. And then we typically have to step back or cut back from some workouts in order to properly recover and treat that area. If you come in before we get to that point, we typically don't have to cut back on activity. We want to keep you moving as much as possible regardless. And we can also incorporate some things that you'll do at home to help us aid in that recovery time period there. So to answer the question, pain every time you train or do an activity is not normal. However, if pain is lasting longer than 24, 48 hours, some of that muscle soreness is lingering, come on in and let's take a look at it. Take care.